All right, welcome. My name is Corinne Waldow. I'm the Economic Development Director at the Boulder Chamber. I want to thank you for participating or listening to this via the recording. I'd also like to thank the other chambers and economic development partners for getting this information out and making sure our businesses are engaged in all of the orders moving forward. These webinar times are available for you to answer questions, provide feedback to current and future orders, and to get support. I'd also like to thank Boulder County Public Health for providing these office hour times weekly. And the weekly time for manufacturing will occur at this time every Thursday at 1 o'clock for both feedback and questions. At this time, I'm going to hand it over to Zach Swank with Boulder County Public Health.
Thank you, Corinne, and thank you to the Boulder Chamber for continuing to host and organize these webinars, as well as the other chambers and economic partners across Boulder County for promoting them. Alexandra?
Yep, okay. So this webinar, just introduce myself.
If you could just go to the next slide would be great. Thank you.
Thank you.
So we're going to touch on a couple things today. For those who have not seen these before, maybe didn't catch some of the other webinars, briefly on the face covering, overview of Safer at Home, and then resources to support manufacturing, and should have plenty of time for your Q&A. As we know, this is one of the most important parts. So just want to remind everybody that we are under Safer at Home until May 26th. At that time, the governor will update what the requirements and conditions are for the community and for the state. It will depend largely on what the rate of transmission are and what the rate of hospitalization is, as well as other factors. But long term, just want to remind everybody that we're going to be under some version of some sort of protocols and public health protections, likely until we have a vaccine, treatment, or herd immunity. And so just want to encourage everyone to prepare that this is going to be months, not weeks. So for the face covering order, this is a Boulder County public health order, and it requires that you cover your face if you're outside of your residence and cannot maintain more than 6 feet of physical distance between you and others at all times. This is except if your health would be inhibited by wearing a mask, or if you're alone in an enclosed room, as well as it's important to note that there are instances when the state Safer at Home order is more stringent than the Boulder County Public Health face covering order. And under those conditions, the more stringent order prevails. So that would be, for example, personal services. If you go in to get your hair cut, the state's order says that you cannot take your mask off, even if you were, 6 feet from others. So the more strict order prevails. Boulder County Public Health is working on putting together a summary of the common scenarios between the differences between the orders and where they overlap, which order prevails. So look for that, and I'm sure Corinne will share that out with you all when we have it. So what is Safer at Home? As just a quick reminder, the virus is just as contagious as it always was, and one of the best things that we can do is to continue to stay home as much as possible. That means if you have employees who are able to work remotely, even if they're permitted under Safer at Home to return to your business, it's best if they're able to continue to work remotely. In our personal lives, we want to avoid gatherings. We want to avoid, close personal physical interactions with others as much as possible. But we do need to reopen the economy as much as we can. And so, as you all know, that's being allowed under Safer at Home with restrictions. And this is new, uncharted territory for everybody. And a big purpose of these webinars is to have a forum to ask questions and share concerns. And then also note that some high exposure risk businesses are still not permitted. So with that, I'm going to turn it over to my colleague, Alexandra Phillips, who will take it from here.
Thanks, Zach. Thanks, Corinne. I'm Alexandra Phillips. I am working with Boulder County Health Department for the Business Liaison section. This is covering manufacturing, both critical and non-critical manufacturing. There's a whole bunch listed on the screen that is on critical manufacturing, and all others would be listed as non-critical. There's two sets of guidelines. The critical manufacturing falls under just the general guidelines that have been issued, and I'll talk a lot more about that and even show you where they are in just a minute. The non-critical has additional guidelines, and I'll also show you that in a minute. So to be safest, I would recommend that the critical manufacturing also look at the non-critical list to do things as safely as possible. So under the general guidelines that is required for the critical, maintaining the guidelines require maintaining 6-foot distancing when possible, sanitizing high-touch areas, ensuring proper ventilation. I know there was a question last time about ventilation, and it's to go to the OSHA guidelines and check that for proper ventilation, avoiding gatherings, and of course, gloves and masks, especially masks. Hear that on all the guidelines. And then in addition to that, also for all manufacturing, this is for the general guidelines for everyone to follow, providing flexible and remote scheduling, so vulnerable employees don't have to come into the office, and even for other employees to just keep the numbers in the manufacturing unit or the office low, and use contactless payment solutions, contactless trash cans, anything you don't actually have to touch. Now, this is what gets into the specific guidelines for the non-critical manufacturing. No more than 10 employees on the site. Establish a system for employees to alert their supervisor if they are experiencing symptoms. And I'll actually talk a little bit more about the symptoms in a minute. Arrange a one-way flow of work and people. And once again, I'm not a lawyer, but this might be a good one for the critical to also look at for the one-way flow, just keeping that contact, the 6-foot distancing as much as possible. Avoid having people face each other, use barriers between workers whenever possible, plexiglass or other barriers, and breaks and shifts so people are not all taking breaks at the same time, or maybe one person takes a break at one time. Again, just limiting the people in the break room or circulating around the building. The compliance with all this is obligatory, and there may be changes to the guidelines as we go, and I'd recommend checking back at these webinars, the weekly webinars that we're holding, for changes to the guidelines, and also to the look at the websites. But also with additional questions about compliance, it's really best to go to your own lawyer and ask your attorney on that one. There's been a couple of Q&A, and I'm turning on my phone real quick to look at some other ones, but there was some questions about temperature screening, how to do that, and it was recommended that one person in the office do that, so there's less people handling the thermometer. You can also do tests at home if it doesn't work in the manufacturing in the facility. There is also a couple of questions that could be answered by looking at the screening form, and I'll show you that in a minute. If there are any positive tests or ones that, if it's not even tested, but they have all the symptoms, to report it to the COVID biz at bouldercounty.org. There was a few others. One I'll just touch on really quickly was, what if some of the people in the office, in the facility, in the manufacturing facility, won't follow the protocols? Well, the facility is responsible. Each business is responsible for ensuring that there's full compliance. So talk to the employees about that. And I think, and then here are the two websites I was talking about, and I'm going to go, or a bunch of places for good information. I'm going to go to the Boulder County one. If you just give me just a second, I'm going to change my screen here. Let's see. Here it is. Okay. So this is at the Boulder County website here, and you'll see, you'll know you're there, you'll see those photos. And if you go down to this lower right bar, click on For Business, it's right there. It opens to another page. Again, you get those photos, so you know you're in the right place. Oops, sorry, it's not as quick as I'd like it to be here. And you scroll down looking for the guidelines. And under the checklists here, checklist for manufacturing is right here. And this is the really, I think Zach was the one who put it together, so thank you for that, Zach. Separated it out. So the top part is for critical and non-critical. That's the general guidelines that I was talking about. And then a little bit further down is the additional requirements. And the big thing that Zach did was he removed all the duplication. So it's just exactly the additional requirements here for the non-critical, and for anyone else that wants to look at it and really make sure they're doing everything as safe as possible. The other thing I wanted to show you on this was all these links. You can go here for symptoms tracking, for the symptom screening, and it goes into a lot of detail on how to do that. And then further down, the employee screening form. And you can print these out and have, so you know what to be looking for there. Okay, now I'll go back to my PowerPoint. Is that working okay? Okay, so there's those two websites. The second one, the first one is the Boulder County, boco.org. That's the Boulder County one. The second one that's really highlighted is the state website. And that's another one with a lot of good information. And the compliance list, compliance with the orders is mandatory. So you have to comply with what's on the checklist. Using the checklist and actually printing it out, looking at it, is voluntary, but it's a compliance aid. It's a communication tool. You can show it to us. You can show it to your employees, to people who are coming into the facility. And there's also, there's a poster. Did you want to, Corinne, did you want to talk about the posters?
Sure, I can do that. Why don't you finish yours and I will bring it up. I'll bring it up after you're done.
Okay, great. Okay. And enforcement, what happens? Well, of course, we're asking voluntary compliance because everyone wants to be as safe as possible right now. We're working on educating, and if there are issues, we may ask you to complete and hand in the checklist. So be aware of that. And then Corinne mentioned earlier that we're running these webinars weekly on all different topics. The manufacturing one is Thursdays at 1. There's a shortened link on the screen, or just go to the Boulder Chamber, and it's really easy to find on their screen. There's also weekly Spanish webinars. You can go to that link, and it's also, that link is also on the Latino Chamber of Commerce. So questions that we'd like to hear from you, suggestions. Also, there's the COVID biz at bouldercounty.org for questions. And we also, the call line is the number on the screen. So with that, we will go to questions, or if Zach or Corinne have anything to add.
I'll start by sharing the posters that were created. So let me share that. All right, so in the emails that you've been receiving from me, and if you're new to these webinars, you'll receive one today. You will get a link to posters that are both in English and in Spanish. They cover everything from, if you're sick, don't come in, by appointment only, posters for collaborative spaces to prevent convening, social distancing posters, wear a mask and gloves poster. There's also a poster that says open for business. And that poster was kind of created by the chamber partners, the economic development partners, and the civic partners to really help businesses identify if they're following the checklist and showing the public that they're following the requirements of the state and Boulder County. It's sort of that just assurance poster that you can put out. There's posters for your bathroom, for washing your hands properly. And like, I've received quite a few questions like, how do I translate these into Spanish? I don't have the resources. We also provided a link for that as well. So all of these have been translated. You do not need to have translation done. All right, so you ready for some tough questions? I'm just kidding. Alexander, would you clarify again, because we've got a lot of questions about this. Do essential manufacturers have a checklist or a separate checklist, or what should they be looking at?
They should be looking at the general guidelines. And if they go to the manufacturing checklist, they're at the top. The general guidelines is what the essential or critical manufacturers have to be following.
Okay, but if they choose to follow the non-essential checklist for safer options, that would provide a little bit stricter in some of those requirements, and they can choose to do that.
Stricter and safer for them and their employees, yes. Mm-hmm.
If a manufacturer finds that one or more employees have been exposed or come down with COVID, what's the steps they should take?
Send them home. So before they infect anyone else, clean their area, and then also let us know at either the email or the phone number that was shown. That will help us. We pass those on to the epidemiologists in the county health department to work with that. It's really good to report it too, because they might be known in their home county, but as we know, a lot of people work in Boulder County and live elsewhere. So it is really helpful to put that information in there.
And I would add that, when I would not hesitate to share that information with us. If you have two either confirmed cases or potential cases, it is required by law to share that information with us. But I would guess that there would be some fears of, well, if I report it, is my business going to be shut down, for a month? No. We are, one of the reasons we are challenged to provide, crystal clear guidance on, if you have a case, this is what you have to do, is because it's very situational dependent, right? If you had an employee who came in experiencing symptoms and was out the door in 5 minutes that morning, that's a different scenario than, an employee who spent the whole day there, coughing and sneezing over all of your equipment and all of your employees, right? So we want to understand, what the exact situation is, and our epidemiologists will work with you to determine exactly what response is necessary in terms of, any additional cleaning, or if there were other employees that, had significant enough exposure that they need to quarantine. So we'll answer all those questions for you. And it's not just a blanket, sort of crude, thou must close thy business for, X period of time. We'll look at the exact conditions in the situation.
And if I may add to that really quickly, on the symptom tracker, that sheet that I showed, temperature, all those things are one of the symptoms, but so is loss of taste and a recent loss of taste and smell, because the virus is showing itself in different ways in different people. So it's good to use that, the symptom tracker.
One of the questions that came up, not on this call, but on previous calls, are any of those symptoms more important than others? So if someone comes in with a sore throat but no fever, should you send them home?
Zach, do you want to take that one? That's a tough one. Because
yeah.
Mm-hmm.
I mean, the answer is yes, but it is also situational dependent. So, follow the requirements in the order, and if you have questions, reach out to us, and we'll help you evaluate. Okay, these are the symptoms that were experienced. I mean, there are ones that are stronger clues than others, but there are also ones that are maybe a weaker clue, but with that one combined with a different one, then that's a strong clue. And so it's complicated. Contact us. We'll help you sort it out.
Good. So you talked a little bit about the symptom tracking and a little bit about the checking at home. What are the conditions in which an employer can allow someone to do their symptom checking at home and email it into their employer before they come in?
Mm-hmm. If they can't, I think the wording is if it's not possible to do it in the workplace. Zach, is that the wording?
Yeah, practicable. If it's not practicable to do in the workplace, then employees can do a self-assessment at home and report it to the workplace prior to coming in.
Okay. And best practices, we've heard some employers, just to protect the privacy of their employees, are selecting one person to kind of be that contact person for symptoms and be the only person that really sees the symptom tracking across multiple employees, correct?
Yeah, and that also, from a safety, contagion standpoint, having a single person, touching that thermometer, dealing with that clipboard, rather than having multiple people touching those things, is better.
And for employee privacy. So a lot of manufacturers have clients or vendors that come in. Yes. How do you deal with clients and vendors?
In the non-critical manufacturing, they have to really limit who is coming in. I think it's only essential, one-way flow. And I think they're also wearing masks. That is all on the checklist. The big thing to think about, and then in the general guidelines if you are having people coming in, vendors, whoever, who are in the vulnerable populations, to have special hours for them, and no limit what needs to be touched, even if it's the doorknob, cleaning surfaces, and setting up a barrier. The barrier part is, I think, listed in the non-critical checklist. So if you go to that checklist, scroll down to about halfway through on it, you'll see the critical manufacturing for customers. And if you go all the way down to the bottom, you'll see the non-critical manufacturing for customers coming in. There are certain specifications for that to keep it safe.
And for the non-critical, just to reiterate what Alexandra said, restrict non-essential external visitors, conduct symptom checks for external visitors who will interact with employees, require essential visitors to wear masks. Mm-hmm. And this is a good example of, where the Boulder County face covering order may be less restrictive than, what's in the state order. So under the Boulder County face covering order, technically visitors would not have to wear a mask if they were not within 6 feet with other people. But the state is saying, no ifs, ands, or buts, visitors have to wear masks. So that is for non-critical manufacturing, obviously best practice for critical manufacturing as well, but not required technically for critical manufacturing.
What are some of those spaces that that businesses need to think about in their facilities that may cause some convening, or the little thought about spaces that employers aren't even thinking about?
The coffee pot. I was just talking to a business about that today. Removing those high touch areas like coffee pots, magazines, or making sure they're cleaned very regularly, bathroom doors, and just the classic water cooler place. Mm-hmm.
I've always also heard about meeting rooms and the hallway into the meeting room. So if you only have a single entry and exit, you might find that you have groups of people entering, even if you have spacing inside the meeting room.
That's a really good point. Yes, to think about if you do need to have a meeting under the critical manufacturing, you can have groups of less than 10. Well, think about before you just call the meeting, how are people getting in and out of the room? Can they social distance during that meeting? To think about all that, and the hallway outside the meeting room, that's a very good point. And thank you for mentioning that.
I know manufacturers have gotten creative as far as the number of people, and what are some of the creative shift or handling of their employees have you seen with some manufacturers?
Well, less people in, for one thing. It's in the non-critical manufacturing, keeping backs to each other instead of facing each other is one. Zach, did you have any ones to add to that?
Yeah, I mean, we've heard of some manufacturers that didn't previously have staggered shifts going that route, and then discovering that, hey, this allows us to keep our lab open longer, or do other activities, that we were previously time limited, to do. And so, I've heard of some folks, discovering that we think we're going to keep this. So, there are some side benefits there to these changes. I also, just want to encourage everybody, if you have a comment or a question, please use the Q&A feature. Hopefully everybody's aware of that. We're happy to take those as well. And then one other resource that I want to share is we've gotten a lot of, let me get these out of the way here. Gotten a lot of questions about HIPAA and protecting employee privacy. The U.S. Equal Employment Opportunity Commission has a great, although lengthy but thorough, document outlining exactly how to handle that. And one misconception is that HIPAA does not apply to all employers. It's only certain employers that handle sensitive healthcare information, whereas the predominant law covering this scenario for most businesses and probably most manufacturing businesses is going to be the Americans with Disabilities Act. And so this document, which Corinne will be, I'm sure, sharing, goes into a lot of detail on what information can be collected, how to handle it, et cetera, et cetera. And I'm not going to go through it all because it's quite lengthy, but again, it's nice and thorough.
All right.
Mm-hmm. And Zach, I wanted to also add to Corinne's question about creative ways of keeping it safer in the workplace, staggered shifts, but in the non-critical manufacturing, it also mentions having groups of people stay together. So if you're working in one group that are on that one staggered shift, to keep that staggered shift the same group of people. That way, you can, if there is somebody who gets sick, it doesn't spread through the other groups.
Great best practices. Thank you for sharing. So Zach, do you want to just maybe close out with some information that Boulder County might be collecting about face coverings that we will be sharing with all employers?
I sure do. Thanks, Corinne. So tomorrow we're going to have a survey going out to the business community asking how face covering is going for the customers coming into your business, as well as how is physical distancing going with your business. And the reason we're sending this survey is we want to better understand the compliance rates of those things as we understand what tools are effective, and to help inform what orders and guidance and actions we might take going forward. So please keep an eye out for that survey. It will help you. Well, it'll help us, help you, and vice versa. And really just trying to understand, what is going on, with physical distancing, with face covering out in the community and out in the businesses, so we can understand how effective those policies are.
Thank you. All right, well, I want to close this out by thanking the participants or anybody listening to the recording for getting the information you need to operate safely. I want to thank Boulder County Public Health for offering these times every week for all these industries. It's a lot of hours, but I really think it's a valuable extension into our community and to the businesses. I want to thank the other chambers and economic development partners who've helped get the word out. We've had a lot of people attend these webinars or listen to the recordings, and it's valuable information that's being shared and an opportunity for your questions to be answered. And I just want to say I hope to see you next week, and you can find all that information on the Boulder Chamber website. There's other chambers that are also promoting the sign up, and have a wonderful day.
Thanks, Corinne.